Hi, and a very big congratulations to all those who have passed the MRCPCH clinicals. Big hearty congratulations to you, really. Here at Dr. Academia, I'm Dr. Pavitra Chakravarti, and I know how much of hard work, sweat, and tears, and the amount of sacrifices you had to make this successful. So thanks a lot, for putting in your effort, for passing the exams. Not only have you made your family proud, yourself proud, you have made all of us here at Dr. Academia, who have been part of your team, and we have been so proud that you followed the processes, you followed the advice, you worked hard, you followed exactly what was being told, you put in your hard work, and today you are successful. It gladdens my heart. We are all so pleased to have your success, really. So big congratulations. Now let's spare a moment for those who could not make it, those who could not pass their MRCPCH clinicals. And what I'm going to speak now is about what is the difference between those who are cracking their MRCPCH clinicals first time and those who are not doing it. Is it a fluke? Because sometimes, there are a lot of candidates who, when they don't make it through the clinicals, they think that, and it might be even a DM student, it might be an MD student who has otherwise been very well, and they have been having excellent track record. And maybe this is the first failure they're having in your life, that they're finding suddenly that in the clinicals they have got stuck. They passed the part 1, part 2 in flying colors. So what is it that might be deficient? What are the factors that might have contributed to the failure? And what are the things which we have noticed over the years? We have been training over more than 10 years now, 10 to 12 years, between candidates to those who make it successfully for the MRCPCH clinicals and those who usually, get stuck in the exams. Now, I must admit that there is an element of, of luck, which is there in most exams. But I would say by far, most of you would agree that MRCPCH is by far one of the most ethical exams, one of the one which is most balanced, and one of the one which is marked most efficiently and fairly. So I think the element of error or bias is very little. So if there is some reason, so if you've not been able to make it through the exam, obviously if you feel that there is a problem, you might can reapply for remarking. But usually, most of the time, I would say there is some error which you are overlooked, something which you have not got right, and we are going to talk about the factors which you must look at if you're not passing through the MRCPCH clinicals, where you are getting stuck, and what we have noticed. And sometimes we can predict very well beforehand that these are the candidates who are going to make it through the exam, and these are the guys who are having, who might struggle to pass the exam. So let us start really. So first thing, those who pass the exams have enough preparation. What do you mean by enough preparation? Well, individuals vary in the amount of preparation they have got and how good they are already with their, the clinics really. So suppose you are someone who's doing a lot of practice and you're not attached with any teaching hospital, or you've not been in any training recently, then obviously to get back to your clinicals and to get your, flow and smoothness in your presentation would take time for preparation. So if someone just comes and does a 3-month course or training and expects that he'll just fly through the clinical exam, it may not be the case. Most of the people I have known, we have known, who have, passed the exam effortlessly, who've done very well, are the ones who have, who have been in touch and have been done the course very regularly. Sometimes they have done it for, they have trained for 6 months, either themselves in groups, or they have taken proper training from mentors who are skilled in them. The problem I find is good to study in groups and have your seniors help you, but sometimes it can be a case of the blind leading the blind. I've had cases where people have told me they have joined certain groups and they were they were obviously training there for some time with very young people who just passed the exam. They were teaching them, but sooner or later they realized that certain things were not taught right. Certain things were wrong. The depth of knowledge was not as much. So I would say if you are actually, if you're learning the skills, the clinical skills, learn it from people who've got a track record or in the training field, who have got a certain amount of experience behind them. See, the exam itself is quite costly. It's about 1.5 lakhs, which is quite a lot of money. So the common sense is I would not waste my time just rushing through it, you're wasting not only your time, but wasting a huge amount of money. Especially which means a lot to you, especially if you're at a registrar level. It's a lot of money really. So, or for anyone for that matter. So the wise thing would be to go for some training or work with your seniors who pass the exam and get yourself assessed in an impartial way. All right. I know people who have done courses or who have done training with some groups where they have been very nice. People have been very nice to them, and no one has criticized anyone. No one has said the feedback was not that good, and everyone was happy until you find that you failed the exams. So what is very important is make sure the people who are training you or even your mentor, they are giving you impartial feedback. That is absolutely vital. And usually we make it such a way that it is a different mentors, so that sometimes a group of people, senior doctors, when those who pass the MRCPCH, each of them gives you feedback separately. You will find that you will really have a 360-degree total, very wide, good coverage of your weak points. And that is only then that you can improve yourself, that you will do well in the actual exams. It's no good being part of a group where where everyone is very happy with each other, and you're being gently said, oh, it's fine, and no one bothers to actually give you the notice, even bother to notice what your main problems are, what your main defects are. So you don't even know where you are. So it is a question of blind leading the blind. You'll only know when you're passing or you're progressing when you're getting an honest feedback, detailed feedback, one-to-one feedback from experienced teachers or mentors, and that's the way you can be sure shot that you're going to pass the exam. Some people 3 months would be enough, but I know a lot of people who have got it right. They have done around 6 months of training or even more, depending on your level of confidence really. And so that's the first point, is that not enough prepared. So make sure you're prepared enough depending on your level of training. Make sure your feedback is good enough that you know that yes, my feedback has been good. I have a certain level of confidence, and your mentors are, they know what they're doing. So the first one is having enough preparation time. Second is there is a language barrier. Okay, so getting your language right or English right. See, the sad fact is this is a British exam. Okay, not sad fact, this is a reality really. So you are expected to have a certain fluency of the English language. Now, obviously the examiner does not know your background. So I know, as I said, I know a lot of students who have not studied in English language schools or vernacular schools, and unfortunately they are brilliant students. They are far brighter than me, I would say. And I know they have struggled with the English, with the language, and their knowledge was excellent. But the ones I know, and I've got great regard for them, because they persevered, they got their language right, they made sure they're using the correct words, they're speaking slowly, audibly, and it's after that they could pass the MRCPCH exam. Because it's not only the knowledge, it's how you express. Because a lot of the training or the exam part is through communication skills, history taking, where your language, what you say and how you say it, because it's a British exam and there's a certain amount of fluency, the dialect, and how your words, appropriate words, which can be misunderstood. So you have to get that right as well. So the language has to be corrected, and nothing to be shy of. You feel that, well, my language is not that smooth. I know the technical stuff, but when I'm trying to present, I'm hesitating, or the flow is not good. There are, we have got arrangements made for your English training as well, so that you got that help as well, so that here at Dr. Academia, so that you're specifically trained to get your English right as well. So that will help you, boost you to pass through the exams, better chance of passing the exam. Number 3 is, I would say, not getting enough rest and not rushing through really. So people who give the exam have not rested enough and have too many things going. So it is just bad luck, I would say. Like, I've got some candidates, they were excellent candidates, but what happened was their preparation was not that good, and they might have pulled it, but just before the exam, few days, and I guess there is nothing you can do about it. But they were unwell, they were down with some illness, and then certain cases I know where there have been situations where there were illnesses in the family. So that is just bad luck really, and what can you do about it really? Well, all I can say is be prepared for bad situations. Be prepared for a situation where the last few days you might not get enough time to prepare. So what's the answer to that? Well, the answer is this. I know candidates of a particular batch, I think about a year back. There were a group of candidates, a lot of them based in UAE, some of them based in Nepal. And they trained with us for more than 6 months. Because I think that was during the COVID time. So they trained with us. They were not getting dates for the clinicals. So they trained sincerely for the clinicals. Now, they trained, even when they were not getting dates, they did not give up. They could have left a gap. Some people left it and left a gap. And those people who left it and left the training for 3 months or so, their knowledge, clinical skills went down, because you rapidly forget what you've learned already. But these people persevered. They kept learning. So they kept the learning was getting greater, bigger and bigger. The skills were getting faster. The confidence was growing more and more. They got things corrected so well. Now, what happened was, at least 3 of them, just before the exam, the one was a lady doctor. She had a shift in a job. She got a job in another hospital, which was a very big and very posh hospital, which was very stressful. The hours were really long, really stressful, and not very friendly people. And she hardly got time to prepare for the last few days, the vital time, the last 10 days before the exam. Hardly got time to prepare for it. But believe me, this girl, and in fact, she had asked us whether she should give the exam or not. But we had said no, because we knew that she had prepared for so long, for about 6 months, and she was so sincere, she was getting everything so right, that we knew that she had enough of it, the knowledge and the skills, that she should be able to pass the exam if she kept calm. And she did give the exam, and she sailed through the exams, okay? But this would not have been the case if she had done just a 3-month course or just trained for the last few months and, had not been that sincere. The level of practice was that, if it was not that intensive, she would surely have not passed the exam. The other one was a candidate of ours from Nepal, and again in his situation as well, unfortunately the last few days before the exam, his parents were unwell, very severely unwell, and they were so busy trying to shift his dad to the hospital, looking after his parents, looking after the family. The last 10 days virtually could hardly go through go through any of the videos, the training videos, go through the sessions or study by himself. Again, this candidate asked us for advice whether he should give the exam or not. Now, that point of time, the exam dates were very difficult to get. And I think we told them that you do go for the exam, because he had prepared so long, for so long, and he was so well prepared. We knew that, even if he does 50% of what his normal capacity is, he was so well prepared, he would do it. And believe me, he took our advice, he went for the exam, and he just passed through the exam at one shot. So again, how did it? What do you think other candidates would have passed in this situation? No, if this someone else who had just done a 3-month quick preparation, the intensity of preparation was not that high, and if someone had not prepared regularly for that long and so consistency, they would not have passed the exam. So there is a saying which I admire very much. It says, long-term consistency beats short-term intensity. I repeat it again. Long-term consistency will beat short-term intensity. And I think this holds good for a lot of things in your life. All right. So here, those candidates who have had long-term consistency, who have been regularly attending the classes, regularly practicing, regularly getting feedback, those are the people who pass the exam without much of a struggle, really. Whereas those people who, all very, full of energy, and they think that they're going to crack it in the last 3 months and everything, well, not all of them pass the exam. Those are people a lot of them who struggle, really. And those are people who are, who you wasting a lot of money, really. 1.5 lakhs of money, it can be disheartening, stuff like that. Anyway, I'll cut the video short to summarize the main points. To make sure that you pass the MRCPCH clinicals, make sure that you have had enough time for preparation, okay? How will you know? Well, once you start a training, or once you start getting feedback from experienced teachers, you will know whether you are ready or not, okay? Some people 3 months would be enough, but some people it might be 6 months. So it is for you to know. Why are we saying this? Because what we don't want you to do is waste 1.5 lakh rupees of the exam fees. It's quite dear, and that money should not be wasted. Also, it is your waste of your time, really. So if you have to give the exam, try to get a feeling from your feedback, from experienced feedback, not some Tom, Dick and Harry, someone who knows what they're doing, where you are. And you know very well that when you're in a group where you're with other people, where you are compared to the other people, and whether you're ready or not. So save yourself the trouble of sitting in the exam before you are ready, okay, or get your level to that high. So one is giving enough time for the preparation, number one. Number two, the English language. Well, the fact is the English language is important. Get your English language right. If you're struggling with the language, there is enough help around. In our courses as well, we offer English language training specifically for just to prepare you for the exams. Make use of it. Make sure that that does not bring you back. And number three, again, be prepared for last minute problems. Some emergency may come up 7, 8 days, 10 days before the exam. So how do you still make sure that increase your chances of still passing the exam? Well, if you prepared long enough, if you prepared consistently, if you have made sure that you had enough feedback and you worked on it, that you gone through enough past recall papers of the previous history taking, the previous communication scenarios, if you've gone through enough of them, then even if things go wrong, because we never know what thing might go wrong the last few days. If you are unwell, you will still sail. There's a higher chance of you sailing through the exam. Well, I hope these observations which we have made, I've made over the last few years, more than 10 years now, help you in your preparation towards the exam, helps you save money, helps you prevent wasting money and your energy, and gets you closer to your goal of cracking the MRCPCH clinicals, and then it will be worth it. Thanks a lot. Please subscribe to our channel, and I look forward to your comments and feedback. Thank you very much.